Concussions are the most common head injury encountered in sports. Our team here at Salina Regional Sports Medicine and Orthopedics Department works hard to ensure that our staff is well trained and well versed to take care of these when they do occur. I'm Dr. Matthew Pyle at Salina Regional Orthopedics and Sports Medicine, here to talk about concussions.
Well, Dr. Pyle, thanks for coming on the show. We're going to be talking about concussions. So let's start out telling us, what is a concussion?
Yeah, so there's kind of a wide array of definitions for concussion. I explain it to patients and to my athletes as it's kind of a bruise on the brain. And it can affect multiple different areas of kind of their actions and their psyche. And so it depends on where that bruise happens, what symptoms they develop. Once we diagnose it, it's really relative brain rest is the treatment for it, and that means we try not to have them have any stimulus that worsens those symptoms, whatever they may be. So it may be that light sensitivity, so we try to remove them from light sensitivity. It may be loud noises, we try to remove that stimulus so as to not make their symptoms worse. The new data, it used to be you locked them in a room and didn't let them out. The new data suggests that we should let them do activities as long as it doesn't make their symptoms worse, and they'll actually maybe recover faster.
I think the important thing is that you have a trained person working with the athlete, right?
Yeah, we're pretty lucky at Salina Regional and that we have athletic trainers on the sidelines and at a lot of the local sporting events to be able to kind of witness the event and then assess that athlete right after it happens and make a decision about whether they should return to sport or whether indeed they had a concussion, and so they would pull them out at that point in time and then start the protocol of appropriate medical direction.
So what schools are you working with here?
Yeah, so we work at Salina Central, Salina South. We also have a trainer that goes out to southeast of Salina once or twice a week during the fall, and then we do Smoky Valley as well once or twice a week. So those are the schools that we cover here in town, and then we have obligations with the colleges as well.
I think in talking with you, it's important for the athlete to be honest with what's going on, right?
Absolutely. It's still a very clinical diagnosis, and what the patient reports to you is still how you make the diagnosis a lot of times. And so I tell my athletes and my patients that come in and see me for concussions, this is the one time not to be tough about something, because there can be long-term consequences that I think are still debated with repetitive concussions or head injuries. And then there's very clear data that if we put an athlete back in to sport too quickly, that acute injuries arise if they're not able to react or to partake in their sport like they did before the concussion happened.
For more information, please visit SalinaRegionalSportsMedicine.com and follow them on Facebook and Twitter.